Ready to jump in? I know a couple folks have joined since maybe I think since I introduced myself, but thank you for being here. My name is Shelby Brown. I'm an external affairs administrator with Aetna OhioRISE. I cover the West region, and we'll dive into what counties those are in a couple slides. But our hope today is really to kind of meet you all where you're at, to kind of tell you about the plan, the OhioRISE plan, but to make sure that we answer any questions you have or to be as helpful as possible. And so as we get started, I think we're going to start like big picture, what is OhioRISE? And then we'll get more and more specific to what does it look like on a member level. Thank you. So the goals of OhioRISE, so we actually, tomorrow will be 4 years since we've launched. And the goals in those 4 years are up on your screen. Our hope is to keep kids with family and in their communities. So to prevent custody relinquishment and to intentionally serve multi-system youth. We hope to add more intensive in-home and community-based services and supports to, again, keep kids with their families and their communities. Family and youth voice is always at the center. So hopefully as you're working with us, you hear frequently that voice and choice, your voice and choice are prioritized. And so we don't want to just talk about families, but we want to talk with families to make sure that the services are a good fit. One of our hopes is to increase stakeholder engagement. So when we say stakeholders, we're talking about all of those different community agencies and programs that serve kids and families. It's like Children's Services, Board of DD, schools, behavioral health resources local to you. And finally, so all of this is done through a shared governance model. And then a little bit more of just our goals and objectives, because we know we can't do it alone. Like the goal of the OhioRISE plan was or is to keep families together, to reduce custody relinquishment, reduce unnecessary hospitalizations and emergency department visits, to decrease youth's involvement with the juvenile justice system, so the courts, to reduce out of home and out of state treatments and placements, and then to increase school attendance and performance. We do a lot of partnering with kids, with families, hospitals, the courts, children's services, and the education system. And I should have probably mentioned this on the last slide, but as you're thinking about, because I know I'm naming a lot of different partners, but as you're thinking about OhioRISE, so we're a Medicaid managed care plan. So we're an insurance plan through Medicaid that covers behavioral health needs. And so as you're thinking of where we fit in the mix of all of, the courts and hospitals, schools, your therapist. So we would be the behavioral health insurance plan, but we'll dive into just some unique and I think creative benefits of this insurance plan. Awesome. So I know you all mentioned the different kids that you're caring for. And so this eligibility requirement is probably where you're thinking, like, how do I fit or do we fit into OhioRISE? And so the info on your screen now is our eligibility criteria. So to be eligible for OhioRISE, the child must be Medicaid eligible. And then at the time of enrollment, be 0 to 20 years old and require significant and intensive behavioral health treatment. We'll talk about the assessment that we use to determine that eligibility. So it's called a CANS assessment. So we'll assess through the CANS assessment if the behavioral health treatment meets the level of OhioRISE through a CANS assessment or an inpatient hospital stay for a mental health or substance use disorder. So the CANS assessment, that's the tool that we use to determine eligibility. It's used for a couple of reasons. So one, we'll use the CANS assessment to assess the child and the family's needs and their strengths so that we can best fit them for service. It'll help us decide what tier of support that family and youth needs for care coordination. So there's a tier 1, which would be limited care coordination, tier 2, more moderate, and tier 3 is our most intensive. And so that can be determined initially by the CANS assessment. And then ultimately it is used to determine program eligibility and then to support the care plan once we do start working with that kid and their family. So once a youth is found eligible and is enrolled in OhioRISE, these things on your screen now are the different services that are available. So since we are covering behavioral health needs, we will cover that child's behavioral health services. Care coordination, we'll talk more about that on a upcoming slide, but care coordination is a big part of it. And so either tier 1, tier 2, or tier 3 care coordination. So that is where you have a care coordinator who partners with the family to create a care plan to just make sure that all of that youth, all of their providers and supports are on the same page and kind of working in step with each other. We've worked to increase IHBT, which is intensive home-based treatment. So that is where the mental health professional will come into the home and work with the child and their family on their different needs. Behavioral health respite is a benefit of OhioRISE. And so caregivers are busy and deserve a break and need a break. And so you can work with your care coordinator to access behavioral health respite. Flex funds are a big part of OhioRISE. And so every member is allocated $1,500 annually to access flex funds. Flex funds have to meet a few criteria. So there are things that can keep the youth safe in their home, more engaged in their communities, alleviate the need for out-of-home care. They have to be worked into the care plan, but there are some creative things you can do for kiddos with flex funds. And then PRTFs, so psychiatric residential treatment facilities, when it is necessary for a youth to leave the home to get treatment, we can help them access PRTFs for a time to receive that treatment. And then I know I missed, so MRSS is Mobile Response Stabilization Service. Hopefully you've heard of the crisis line 988. That is like our statewide mental health crisis line. So if you call 988, you'll reach a mental health professional who can talk you through a crisis. But if you are working or living with a youth 20 and under who is experiencing an emotional mental health crisis, if you call 988, someone can respond and just work through that immediate crisis with that youth and their family. So creating a safety plan, it's not a long-term service, but they can respond in the moment, try to stabilize things, and then get you connected to more long-term supports. And so there might be questions and we can talk through all of the different services, but that's kind of a high overview of the different services. And I think this next slide kind of goes into a few more in depth. And so part of what OhioRISE was positioned to do is to not just serve members, but also to increase supports within the community. And so through that, we've helped to expand IHBT, which is that in-home intensive home-based treatment, increase PRTF beds, so those psychiatric residential treatment facilities, beds there. MRSS continues to expand and to kind of become more stable throughout the state, and then care coordination, which we'll dive into shortly. Stephanie, I see you have your hand up. Do you have a question for now?
Well, I mean, I don't know what's after this. I don't know what you're going to say after this, and I'm afraid because of the situation, I'm not writing anything down. I'm afraid I'll forget. So in this presentation, this is like
beautiful. All right, Shelby, back to you.
Awesome. Thank you, guys. If you want to move to the next slide. So this is sort of a pivot into more specifics regarding care coordination. So many acronyms, but oftentimes when navigating OhioRISE, you'll hear CME. So the CME is the care managed entity so Aetna OhioRISE has partnered with the CME, a care managed entity, in every county in the state. So every county is covered by one of these care managed entities. In a couple slides, we have the map where you can find out who is covering your county. I know in my region, it's NIAP, but there's quite a few. And so we talked about the tiers, tier 1, 2, and 3. So if a member is in tier 1 care coordination, Aetna does the care coordination. But if you're in tier 2 or 3, those members are receiving care coordination through these CMEs. The pro of that is they're local to you. And so they're in your community and can be more of an expert, like on the ground resources or resource of what's available in your more local area. And so the CME's primary responsibility is that tier 2 and tier 3 care coordination. But then they also are working to develop resources in the local communities. And then on the next slide, so once you're enrolled and you've received your care coordinator and your tier level, the care coordinators help to lead this high fidelity wraparound approach. And so the goal is that this care coordinator is sort of gathering all of the different providers, community supports, natural supports. So you all as caregivers, gathering everyone and just the knowledge that they have on this member and their needs and working together to create a plan. And so what's an immediate need that we have to figure out now as a team? How do we make sure we're not duplicating services and we're all kind of moving in step with each other? Together, this care team can deep dive into what the kid needs, what the family needs. They use that CANS as the launch point of what those needs might be. And then together they work to advocate for that child and get them what they need. And so also depending on your tier and level of need, that will help determine the cadence that this group meets. And then just some more specifics on what each tier entails. So down at the bottom in the blue, you can see it. So tier 1 is limited care coordination delivered by the OhioRISE plan. So through us at Aetna, this is targeted towards members who need a lower intensity care coordination. And so there's still the wraparound principles, but maybe not as intense. Tier 2 and 3, so again, that's delivered by your local CME. Tier 2, there's a wraparound informed model for members who have moderate behavioral health challenges. The team will decide the appropriate frequency of planning and monitoring that care plan. They will help to increase that network of support for the member. And tier 3 is our most intense. So that is the high fidelity wraparound approach for members with a significant behavioral health challenges. And so they'll meet very frequently, be in close contact with each other, with the members, with the caregivers, serving youth with the most complex and diverse needs. And then I think I pass it off to Elizabeth, who will share that CME map where you can figure out, what CME is covering your area.
Yeah. And just to add, let's say you have been determined to be at tier 3, and your grandson starts to do a lot better. They're going to counseling, behaviors are improving. You guys really feel like, wow, we don't need to meet weekly or every other week with our care coordinator. That's where your voice and choice comes into play again. The family can request to tier down to Aetna OhioRISE. You still have all the same benefits. You just don't have the frequency of meetings with the care coordinator, and you would shift from your local CME to Aetna OhioRISE. So if you are at a certain tier, you're not there forever. It's really up to you. And some families might score a tier 1, but really feel like they want that frequency of tier 2 or tier 3 coordination, and they're allowed to have that because of voice and choice. So we'll dive in a little bit to what we call catchment areas. So youth are referred based on where they live, based on their zip code. And what is used to determine that is obviously your zip code. So the agencies in that area are listed here. Goldie, I Googled where you live when you mentioned it because I had never heard of it. And it looks like Lighthouse Youth and Family Services in Hamilton County would be your CME. So we can use maybe that as an example here in a second to go about getting you enrolled there. So the big way to get enrolled is through a CANS assessment, and that stands for Child and Adolescents needs and strengths assessment. So you would sit down with someone from the CME. They would go through all of your family's history, what's kind of going on with your family member, and determine where they score tier 1, 2, or 3. So it's called a CANS assessment. So if you hear that acronym, that's what that is referring to. It's the tool to determine what level of tier you guys are served at. Just curious here on the call, who is currently linked with the CME, and if you can share which one? See all the different zip codes that are covered here. And then on the next slide, you can see how Franklin County is broken down. So I know some of you had mentioned the Buckeye Ranch and the Village Network. So you would find your zip code here to kind of see who you're connected with. So there's several ways on the next slide that are listed to show how to get referred to OhioRISE. You can refer your own family member. You can be referred from a psychiatric hospitalization. Anyone in the community could refer. So a therapist, a school teacher, a caseworker, anybody can refer. And so here are a few options on how to go about doing that. I would say one of the easier options is to go through the CME at times. Another option here, though, is to go through what's called the managed care organization. So that is essentially the medical piece to your insurance. So most of you might have CareSource or Buckeye or Molina. So they manage the medical piece of your insurance plan, and then they would refer you to OhioRISE for the behavioral health component. And there are some numbers listed here on how you could get enrolled by calling the MCOs. And then the next two slides are Medicaid's hotline to call, and they can kind of route you with the nearby CANs. So that this is a general number you can call that would look up your zip code and then give you the appropriate number for the CME that's located in your area. And then last but not least is OhioRISE's member service line. So it's open 7 to 8, Monday through Friday. So you can also call this number and figure out, maybe you don't know your care coordinator number. You could call this to find it. That's one thing that this is used for. But for this purpose, it is used for to get enrolled and get the CANS assessment completed. And then the next slide breaks down our regions for our external affairs team. So you can kind of see there's several of us covering throughout the state. I'm covering the northeast part, the gray section, and then Shelby has the west over there. Yep. And then the next slide has our contact information. So we can provide this to Angela, or if you want to jot it down, if any needs might come up, you can certainly reach out to your local external affairs person. Myself and Shelby are listed there. Nick is also on there. He is filling in currently for the Northwest region. So if you guys need anything in a particular region, these would be the external points of contact for you. One thing I wanted to highlight, and this slide covers it, is that OhioRISE goes up to age 21, which I think is so helpful. Kids and young adults really aren't ready to be on their own at 18, like they maybe were a few decades ago, especially those that might have some behavioral health needs, some trauma, or have been in children's services custody. So allowing this program to go up to age 21 is super helpful because it connects them to all the services that they might need. It won't drop off the second they turn 18 like many services do. So I wanted to highlight that here on this slide. And then the next one is questions. Before we jump into that, I wanted to drop in a few things into the chat right now that we can talk about too. One is for Ohio Can with a K, Kan. Has anyone on this call heard about Ohio Can before?
Yes.
I think a lot of us have too. They've done some presentations with us.
Yay, good. I know I would be amiss to not mention them. I figured you guys were super plugged in with them. They're such a wonderful organization. So I just wanted to drop that in just in case you all were not familiar.
Yeah, thank you.
Yeah. And then another is a flyer for NRSS. So they can help, as Shelby mentioned, with crisis that might pop up. So they can come out to your home and kind of help with crisis interventions. And every county now has an MRSS team. So that flyer there kind of explains how to get connected and to call 988. So I wanted to share those few resources with you all. And then if anyone had any questions, we can kind of dive into those.